What is the best treatment for my dark under eye bags? I am 24 years old, Filipino, and have a distinct Filipino dark puffy eye bag look. I'm a healthy, water-drinking, fit individual. Bags are more apparent when I smile, adds years to my face. I'm looking for a permanent solution without the worry of makeup washing off when it rains or during summertime swimming. Help.
Thank you for your question. You're 24 years old, you're of Filipino descent, and you have submitted several photos that are very helpful, and you describe in detail how you have some issues with dark circles under the eyes, as well as the presence of bags under your eyes, particularly when you smile. So you're looking for some guidance as to how to deal with these concerns. Well, I can certainly assist you. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon practicing in Manhattan and Long Island. Under-eye bags is something I've been helping people with every day of my practice for over 20 years. So I think that there's an opportunity here for you to become more educated as to the definition of your concerns and whether or not it's appropriate to seek some type of solution. So when people come to us for under-eye bags, more commonly it is associated, the bags are there constantly regardless of facial expression. And when that's the case, like particularly when the face is relaxed and you see bags, that's usually caused by something called lower eyelid fat prolapse. What that means is the fat that's normally around the eyes pushes forward and creates this bulge of fat. And it is routine for us to address these fat pockets with local anesthesia, light sedation, and most routinely we do a procedure called transconjunctival lower eyelid blepharoplasty. Now, when someone like yourself presents to our practice and has this type of problem where they don't have bags when their face is relaxed, but do have what they perceive as bags when they're smiling, well, most likely this is caused by the contraction of a muscle called the orbicularis oculi muscle. Now, this is a muscle that supports the eyelid. It's responsible for the position as well as for blinking. So when you smile, it's kind of like contracting a bicep muscle. The muscle bunches and the skin bunches with it, and it results in what you perceive as a bag. Now, when people have come to us with this concern, and they say they really don't like it, I've always shared with them the importance of this particular muscle at baseline for proper eyelid position. And if this muscle were, let's say, for example, relaxed with Botox, it is possible to get some improvement, but in order to keep the balance where the muscle tone is still there to provide proper support, it may not be dramatic enough to justify the cost and the trouble of doing these procedures over and over. But I think that for the majority of our patients who I explain this to, they at least feel like they understand why they have this type of ridge under their eyes. Now, from my perspective as an artist, as a cosmetic surgeon, I don't find these types of issues to be aesthetically a problem. I think that it's part of the look of when someone smiles, to have that bunching when that occurs. And of course, a smiling face is always an attractive face from my perspective. So I think that you could consider experimenting with using some Botox or Dysport to see if that muscle tone can be improved. But I think that I'm always hesitant and more conservative when dealing with people who are younger like yourself and requesting some type of procedure where how practical is it for you to do this in your with your lifestyle? And it is, of course, different when someone enters their mid-30s and beyond, but in your early to mid-20s, I think it might be a little bit of a challenge to justify the expense and the trouble, but that's a personal decision. As far as the pigment is concerned, just for the completeness, it's essentially a genetic trait. And since you're young, I would not do what I usually do for people who have dark under eye circles or hollows, where I use something like platelet-rich plasma, which is derived from your own blood and is used to stimulate the skin and improve skin quality, or combine that with hyaluronic acid with platelet-rich plasma to help with under eye hollows, which you don't have. So again, with a genetics issue as well as a functional normal issue, and in the context of being young, I'm really hesitant to suggest you pursue aggressive treatment. Certainly, I think it is appropriate to meet with qualified, experienced doctors, but at least remember that whatever suggestions are made, you have to think of sustainability. If you want to experiment and see what happens, I think drugs like Botox, Dysport are fairly safe and can be worth just to satisfy the curiosity. But otherwise, I just think that you would probably be better off waiting to do anything for a few years. So I hope that was helpful. I wish you the best of luck, and thank you for your question.